Press it a bit, give it a bit of pressure, and then that's it. It's already inserted.
Hello, good morning everyone. Hi, today we're going to talk a little bit about a lot of people ask me this question. So I'm wearing this CGM or continuous glucose monitor for quite a while now, and I just want to give a brief introduction or explanation on how it works and why it works and why I'm using it to monitor my blood glucose. So hopefully this short video helps out you guys. So I guess to actually before you understand what the CGM actually does, you need to get some definitions right. But actually, what exactly is diabetes or clinical diabetes? How do people actually know that you have diabetes? So actually there are two ways to diagnose diabetes. One is called the OGTT, or oral glucose tolerance test, I believe. And the other one is, of course, using HbA1c or glycated hemoglobin A1c test. So basically, these two methods are used to define whether you are normal, pre-diabetic, or diabetic. So basically, the first method, the OGTT test, is when you go to, you have to fast, like overnight or something. And then before you do the OGTT test, they'll give you a drink of pure glucose. I think it's 75 grams of glucose. That's quite a lot. So you have to drink this glucose, and then they will test after 2 hours, they will test your glucose levels. Okay, the other method, the HbA1c hemoglobin, glycated hemoglobin test, is actually measuring the amount of glucose you have attached to your red blood cells, hemoglobin. And hemoglobin is actually quite a good way to test because it measures red blood cells actually survive about 90 to 120 days in your body. So the amount of glucose attached to these cells will indicate to you a history for the past 3 to 4 months. So basically, you need to test this HbA1c. You can test it like every 3 to 4 months. So again, what is the definition of someone who is diabetic, normal, or pre-diabetic? So it's the percentage when you do the HbA1c, depending on these are the clinical definitions. So we have to monitor these tests, and you can know how bad your glucose is. You also need to understand what exactly is type 1 and type 2 diabetes, and also what are the causes. For example, for type 1 diabetes, it's usually when the pancreas cannot produce enough insulin, and then you need to supplement the insulin yourself through shots or something like that. For type 2, is something a bit different. Type 2 is when your insulin resistivity increases. Means that your body is no longer, or your organs are no longer so sensitive to insulin that it needs a lot more insulin to work. So that is type 2. So type 2, usually you take drugs. Type 1, usually they'll give you some sort of insulin shots. So what exactly is insulin? So insulin is actually a hormone produced by your pancreas, and they are produced by, they call them beta cells. So these beta cells produce insulin to be released in your bloodstream when the body detects that there is glucose in the blood. So as I mentioned in earlier videos, you only have like 1 teaspoon of glucose. A normal person, a healthy person, only have like one teaspoon of glucose going through the blood at any given time. And what insulin does is it helps to maintain that amount of sugar in your blood. So if you are diabetic, then either because of type 1 or type 2, then you will have more glucose flowing through your blood in your bloodstream. So this is the controls. Some people have problems like their beta cells can't produce enough insulin or they can't produce insulin at all. And for type 1, then of course then you have a lack of insulin. For type 2, it's because due to lifestyle that you have been eating too much or drink too much sugar and glucose and stuff all the while, that your body no longer responds so well to insulin. So your pancreas might be okay, it's producing a lot of insulin or it's producing more insulin just to get the same amount or same effect from a normal dose of insulin. So that's why you have to identify what type of diabetes you have. It's very important. So this will affect your medication and also what kind of treatment you are going to get. So the type of diabetes I have is type 2. I'm not insulin dependent. I'm taking medication. And another thing which or my doctor advised me was it, uh, our body weight or body mass index has a big influence on type 2 diabetes. So when you carry a higher amount of body fat, this causes your chances of getting diabetes goes up a lot higher. So as you guys know, you've been watching my videos over the past year or so, or more, then you will know that I was carrying around quite a lot of body fat. My body weight last year peaked at around 127 kilograms. That's quite a lot. Almost 300 pounds, I guess. Um, so that was one of the ways that I quickly tried to overcome my diabetes. When I first found out that I had it, was try to reduce my weight quickly. So actually, it not only helped my diabetes but also reduced my high blood pressure. I've been on high blood pressure medication for a few years already, and right now I'm taking about 5 milligram amlodipine per day. Previously, I used to take about 10 milligrams, but because after I lost my weight, then my high blood pressure also went down significantly. Like today, I measured myself, I was about 121/75, which is pretty normal and pretty good. But I'm still on the 5 milligram amlodipine. Hopefully, if I reduce my weight more, then hopefully it'll go away. So keep that in mind. The CGM stands for Continuous Glucose Monitoring System. So what it does is it's an attachment you fix to your fatty part of your body, and when I attach it to the back of my arm, and also some people attach it to their abdomen, and there's a little short filament which goes into your body actually. So it penetrates the skin and it touches I think some of the fatty area of your body to do the measurement. So that's the first thing I need to clear out is that the CGM does not actually monitor blood glucose directly. It's actually pretty accurate, but there will be a small time lag between the glucose levels in your blood and the glucose levels in the fluid. So usually it's not something you would use for immediate if you want to find your immediate glucose levels, it's still better to use the glucometer and test the blood directly. But the usage for this is actually to see trends. Because it's monitoring the levels of glucose in your body and how it goes up and how it goes down, how your body reacts to the amount of glucose which actually is being cleared by the insulin or not. So that's why yeah, don't get misled. People say, oh, you can use it, then you don't need to use a glucometer. And I say not true. You still need to have a glucometer. Firstly, uh, if you want to take your immediate glucose levels, and also it's good because you need one to do some calibration. Later I explain to you. Because the app actually allows you to do calibration between the readings in your CGM and your glucometer to get more accurate readings. Okay, so I've actually filmed a short video on how to use and how to install the CGM. Let me just demonstrate this thing to you so you can see how easy it is.
Okay, let's see how to remove it. Basically, I just have to peel off the sides. This, and it just comes off. See? Very easy, just remove it like that. Peel it off. Not a big deal at all. No pain, nothing. Now I'm going to take a shower, clean up the area a little bit, and then I'll insert the new one. Okay, I've had my shower and I tried to clean it up as best as I could, but I think just soap is a bit hard. I'm going to try to remove the glue residue with some alcohol swabs and see if it comes out. Better to clean it up properly before we install the new sensor. More or less got it all off. Here's a pro tip. Thing is quite useful to use a bit of baby oil to wash it off first. The glue is uses, I think, oil as a solvent. So anyway, this is the Linx CGM. It's a new one, and I'll show you what's inside the box.
Okay, so I've opened the box, this unboxing. So what's inside is the CGM and applicator, which is in this module. And of course there's a little instruction booklet which you can go through and read if you want. Alright, so this is the applicator. You will see there's a little sticker here which seals the cover, and you can either take it out or just turn it, and then this comes off, and you can see inside that's the new module. Okay, so but I'm going to clean my arm again with another alcohol swab, because just now I washed it with some other stuff. Alright, so you want to put it here, somewhere around here, roughly the same spot where I put this the first applicator, the first module. And then what you need to do is there's a little button here, you're going to press it against your skin where you want to put it. Press it a bit, give it a bit of pressure, and then that's it. It's already inserted and stuck to my arm. That's it. And then next you have to pair it back with the app so it starts taking readings again. Quite straightforward And don't worry, there's a needle and everything, but there's no pain. And then this you can discard. So I've opened up the app and it's asking me to pair with a new sensor. So all you have to do is press pair, and then there's nearby sensor. So you just have to pick the new one. So pairing in progress, and then you click pair, and it is connecting. Automatically confirming new sensor. Sensor warm up. Okay, sensor warm up will be 60 minutes. So I won't get any reading until 1 hour is over. It's going to do some calibration and stuff. So I guess it's quite straightforward. Nothing difficult or tedious about changing the sensor or putting on a new sensor at all. I'll be continuously using these sensors to test different foods and stuff for you guys.
So as you can see, it's not that difficult lah. Just a simple procedure. It's totally painless and hassle-free. You use Bluetooth. Your app just needs to connect via Bluetooth to the sensor, and then you're good to go. One thing I need to remind you guys: when you install it, then it takes about 1 hour to do some warming up. Says out on the app, like, so you just follow what's the instruction there. 1 hour to warm up, they say. But I think it's more like the filament needs to get soaked and wet inside the fluid on your skin, under your skin. So a lot of people have told me that the first half day or one day, the first day, the readings may be off a little bit lah. So just keep that in mind. Some people actually install the new unit the day before the old one expires, but they don't activate it yet lah, because it's all activated by Bluetooth. You can be there for a long time, doesn't matter. So you can actually do that. Like this one, once it's going to expire, maybe 12 hours before it expires, I slap on the new one, and then when the old one expires, I just pull it off, and then on the app I activate the new one. So as I was saying before lah, so this CGM is actually good for monitoring trends, and I've been using it in some of my videos. You've been seeing it, so like I go out and have some food and see whether is it suitable, does it cause a huge sugar spike, and based on our digestive system, it takes about 2 hours to digest the food. So after 2 hours, you can see the response, whether the glucose levels go down to normal or not. If your insulin response is good, sensitivity is good, then you should see it go down to the normal levels. About, for me, it goes down to about 5, 5.1, 5.2, or a bit more mmol per liter, right? If your insulin sensitivity is bad or you're insulin resistant, then it will take a longer time, or it will not go down so low. Usually you go down to about, some people go down like 6, 7, whatever. So the CGM is useful in this way. The other point I want to make is, I've seen some videos of some people who test individual portions of individual foods. For example, take a bowl of rice, eat it, and then monitor it on the phone. Or they take one apple or fruit, and then they eat it, and then they see the response. And then if the response it goes up high, and then it crashes or whatever, then they say, oh, this is not good lah. I think that is not so realistic in the sense that you can't judge one single food based on its reading by its own, I guess. The reason why, number one, is we usually don't eat foods like that on its own, right? I mean, you don't just go out and have a bowl of rice, that's it. Or you don't go out and I don't know, eat just like yellow noodles by itself, right? Usually you have it cooked with some dishes or some meat and protein and everything in it. So I think that it makes more sense to do readings or measurements based on the whole dishes or the whole foods which you eat. For example, char kway teow, right? I believe if you eat only the kway teow, if you only eat the kway teow, then you will get a sugar high spike. Then you will say, oh my goodness, all kway teow don't eat. That's not the way we eat. We eat only, you can try, even I believe you eat kway teow soup and you eat char kway teow, or you eat, a different type of dried kway teow, sambal kway teow, whatever, all will give you different kinds of responses. Then you can choose, but that's the way we eat. Because like, for example, char kway teow, there's a lot of fat in it, right? It's fried. Then you have eggs, you have the prawns, you have the cockles, whatever, and there's protein in it. So after eating char kway teow, I thought, hey, my blood sugar response wasn't that bad. It went up to like 7, I think it was like 7 or something. which is not too bad actually. It doesn't really cause a huge spike or anything. And then after 2.5 hours, 2.5 hours, it went down to normal levels again. So I mean that's how I look at it lah. Maybe some people might have a different idea. They just say that, oh, you need to test individual things. Then in the end, you end up you can't eat anything because a lot of fruits and vegetables, or even like even carrots. Like carrots have a high glycemic index, right? If you eat only carrots, then you get a very high spike. So think about it lah. I mean, this is just how I'm looking at things. So okay lah guys, that's the video for today lah. Don't make it too long. So a bit boring, I know this type of stuff, but I think if you are looking for information about this, and I mean this is all again based on my experience, and don't take it as medical advice. Go everything you need to consume or do, check with your medical practitioner or your GP or your doctor first lah. Right? Just in terms of sharing what you know at the moment. So okay, have a good week ahead. I'll see you in the next one. Right now I'm cutting down on the food videos a little bit because I can't go on and eat so often. So just be a bit patient. I'll try to do 1 or 2 videos a week. But that's like the maximum. I can't. I'm eating mostly at home. Or maybe I can share some videos of some recipes I eat at home and how I eat. Alright guys, thanks a lot for watching. See you again in the next one. Bye bye.